UCSF Health Dietetic Internship is more than 3/4 of a century old. We are one of the top academic medical centers in the country, and we provide a great training experience for the future dietetic professionals, both those that are in our internship, but also those who are practicing. We're proud to have more than 50 dietitians on staff, plus about a dozen dietetic technicians, in addition to a ton of culinary and other individuals. So we provide a very well-rounded experience. We have a very high success rate on the RD exam, although probably the biggest measure is just the success of our graduates more than anything.
UCSF's Dietetic Internship is for an intern who's really looking for a solid background in medical nutrition therapy. I would say that's the biggest portion of our internship are our clinical rotations. So somebody who's really seeking that experience in a hospital setting, both with pediatrics and adult care, is probably going to be of the most interest to those types of interns.
This program definitely prepared me for a career in dietetics. You get a really robust foundation in clinical, which is a strong foundation no matter what area you go into.
We are very hands-on with our interns, so it's really like a learn by doing kind of philosophy. So you're not just shadowing, you're not just watching.
The department and the organization care deeply about sustainability. The interns have been really helpful in helping us calculate how much our purchases for the patient menu contribute directly to greenhouse gases. And that's just given us a lot of insight to make changes in terms of bringing more plant-forward dishes and getting really creative in the kitchen with different ways that we can still be patient-centric, feed patients on demand, and feed them in a sustainable manner.
We get to see all sorts of conditions in patients. Guarantee we see some different conditions multiple times that others may never see in their career.
One of the biggest things that really drew me to the Bay Area in general, and of course UCSF, is just how diverse the population is and how important cultural competency is. And I think being a healthcare provider maybe in the past has been a little bit more black and white in terms of the things of what we've been taught, but we're now moving more towards a cultural competency where we understand that things have to take into consideration more than just like what's presented to you, but also maybe social factors, cultural factors, upbringings, that sort of thing. And I think UCSF is doing a great job with that.
When you're actually looking at a patient's like lab values or like medications or their history, it's a lot different than you would do your case study in your master's program. That's much more easier.
Just think of it as healthcare is a relay race. The baton gets passed to you, you fill your role, you do your services, then you pass the baton to the next person, and together you provide the best care to the patient.
The first thing that interns do when they come into work is touching base with their preceptor before going through all of the patient lists and screening patients according to UCSF's priorities of care.
Yeah, we answer consults and we case find based on different things that we see on the screen, whether that's weight loss or a special diet need. And with that, we then come up with our work list.
Prior to visiting the patient, we chart review to determine how we can best support them nutritionally.
Interns work with preceptors one-on-one who help guide and support every intern so that they can grow in their knowledge and skills to become an independent member of the interdisciplinary team.
As you get more to your third or fourth rotation, you also take more responsibility with the nutrition support. So you'll have to add in labbing and flowing and making sure you get that all done in the morning, especially with parenteral nutrition since the TPN orders are due by 1.
We would see our patient, interview them by lunch, maybe 12 or 1 p.m. And then the rest of the day would mostly be like documenting all the information and then reviewing the notes with the RD.
UCSF is consistently ranked in the top 10 hospitals in the nation. So when you come here, you're really learning from the best and taking care of the best variety and complexity of patients that you can.
Everyone is so supportive over here and also always give me help and always teach me throughout the entire year.
We are definitely treated as a vital part of our teams. We work with the medical doctors, the pharmacists, case managers, social workers, speech language therapists, occupational therapists. We have the nurses. We have such a large team and every member is a crucial part of the patient care.
So UCSF has a great reputation, and we also, I think, offer a lot of benefits within our dietetic internship, such as healthcare options, meal stipend every day to support interns who aren't working otherwise, and then also we are one of the few programs in the country that offer a financial stipend to our interns to help support them throughout the internship. Very few in the country have that at this point.
Not only the cutting edge work that the dietitians are doing, but physicians, nurses, other allied health professionals. In addition to that, we leverage the strengths of the Bay Area. So we have 3 hospital campuses where people can get a wide variety of training experiences. In addition to that, we have more than 150 clinics throughout the Bay Area. There are opportunities for our dietetic interns to work at some of those locations. In addition to that, we also provided other types of community experiences and give interns the opportunity to potentially work at Bay Area technology companies or other companies where they might in fact have an interest. And we're very proud of fostering and facilitating those relationships over the years.